Hello class, Dr. Delvecchio Gilbert here. Make sure everyone takes a number. Don't think that you're going to sit near your friends this week, and have a seat. So, today we're going to go over vesicouretal reflux. So, vesicouretal reflux, also known as VUR, is the abnormal flow of urine from your bladder back up through the ureters, and then that connect to the kidneys. So, and if that is the case, then it can lead to kidney damage. VUR is usually diagnosed in infants and children, and it does put you at high risk for UTIs, which if those are untreated can also lead to kidney damage. So VUR can be primary or secondary. If you are primary, the child is born with a defective valve that normally prevents the urine from backflowing into the ureters. So it's almost like the esophageal sphincter of GERD. When the acid comes back from the stomach and goes up through your esophagus, the sphincter doesn't close, so that's why it's coming up. So just like this, if the valve is defected, it will let the urine backflow up to the ureters. And then in secondary VUR, it occurs when the urinary tract has a malfunction, and it often causes abnormally high pressure inside the bladder. So children may outgrow primary VUR, and treatment includes medications or surgeries, and it aims to prevent any kidney damage, so getting that far through the ureters to the kidneys. So symptoms of this is a strong persistent urge to urinate, burning sensation when urinating, passing free, frequent small amounts of urine. So these are all symptoms of UTI because you have a high risk of having a UTI when you have VUR. So pain, strong urge, frequent small amounts of urine, blood, cloudy urine, foul smelling, fever, pain in your flank or abdomen, and holding urine to avoid. And everyone doesn't like having pain when they're voiding, so children like to hold it in. Some signs and symptoms, if your child does experience that you should call the doctor when these occur, are changes in appetite, changes in mood, diarrhea, or vomiting. So what causes VUR? The urinary system includes your kidneys, ureters, bladder, and urethra, which we all know. And they all play a role in removing waste from your body, such as urine in this case. Ureters carry urine from your kidneys down to your bladder, where it is stored until it exits the body through another tube, your urethra, during urination. So, risk factors of VUR are bladder and bowel dysfunction, race. White children appear to have a higher risk of VUR. Sex. Generally, girls have double the risk than boys do, unless it is present at birth, which is more common in boys. Age, so infants and children up to age 2 are more likely to have it than older children. And primary VUR reflux tends to run in families, so family history is big. Some complications that can occur from VUR, so our main concern is kidney damage. And then there's kidney scarring, high blood pressure, and kidney failure. So we just want to make sure that it doesn't get to the point where it's damaging the kidneys. You guys need another bathroom break? Okay, 5 minutes. So how do we prevent VUR? There's no way to prevent VUR. But good habits can help your child from developing a urinary tract infection. So drinking plenty of fluids, follow good bathroom habits, urinating regularly, wiping from front to back for females. Make sure you change any soiled diapers as soon as possible. Treat any constipation if there is any. And then we as nurses want to identify care that is best for the child. So again, it can happen from birth in 2 years to older children, not commonly, but any age can get it. So we want to base our care based on their age. We want to find treatments that and medications with the best dose for these children. And we want to understand how treatment affects a growing child's body. So for nursing interventions, we want to include daily weights, make sure they're drinking enough. We want to educate parents and children, if they're old enough, to understand what is going on and what we can do to prevent this. Some diagnostic tests that we can do to diagnose VUR are abdominal ultrasounds, x-rays. We can use a urinalysis to diagnose any UTIs. Intermittent catheterization can be used to help empty the bladder out. So treatment for VUR would be prophylactic antibiotics, anticholinergics, and we want to, as nurses, allow the child and family to express any concerns. We want to ensure that the child does have access to the bathroom or commode or urinal, so they can have a good bladder training program. We want to encourage the child to empty his bladder completely every 2 to 3 hours. Again, daily weights. If the child has secondary VUR, they can have surgery to either remove any blockages that's happening from keeping that urine from emptying completely. So we want to educate the client and family about that. We want to be there for them and support them throughout this whole process. We want to make sure that parents are enforcing their children to finish any antibiotics. No matter if the child looks better or they're feeling better, we always want to finish that antibiotic. And we want to monitor vital signs, pain level, fluid balance, urine elimination, and signs and symptoms if they go for surgery for post-op complications. So that is VUR. And if you have any questions, you can email me or visit me during office hours. Thank you.